As service members return home, some continue to battle with their mental health, and unfortunately, some cases do end in suicide. September is National Suicide Prevention Month, and September 22nd specifically is Texas Veterans Suicide Prevention Day. So joining us today is Dr. Blake Harris, Mental Health Director for the Texas Veterans Commission. First and foremost, thank you so much for being here. Obviously, this is a very important topic. For those who don't know, talk a little bit about the work that you guys do as a commission and why it is so critically important.
Oh, wonderful. Yeah, so at the Texas Veterans Commission, one of the first things we say is we're not the VA, the federal VA. We work very closely with them, but we are state government. And our focus is on making sure that Texas service members, veterans, and their family have access to competent mental health services. So we do that through connecting them to local resources, providing a lot of technical assistance, and doing a lot of training across the state.
Yeah, and I know that you guys have a military veteran peer network. For anyone who is watching right now, how exactly can they get connected? What sort of resources and support will they have being connected?
So the Military Veteran Peer Network is one of the programs I'm most proud of. It is a cadre of folks that are trained and certified by our office. They are veterans themselves, and they work directly with veterans and their families, providing individual and group-based peer support. They get them connected to more traditional mental health services, and they also help them find local resources, which is really important when we think about suicide prevention. They provide training as well to community stakeholders, and they get folks connected to local resources and provide support to the veteran treatment courts and those veterans who are experiencing homelessness and those who have been involved in the justice system as well.
Yeah, I can tell this is something that you're obviously very passionate about. On a personal note for you, what is something that you hope anybody who is watching right now will really take away about, you all trying to spread awareness, not just this month, but continuing these important conversations?
Yeah, so Suicide Prevention Month is coming up, but also, the 11th of every month is what we call Buddy Check Day, and we use that as a reminder for anyone to check in on those who, family members, friends, check in on a veteran, see how they're doing. But I think the key takeaway is anyone can be a gatekeeper, is what we call it. Anyone can intervene and help save lives by educating themselves on what are some of the risk factors for veterans, what are the protective factors, and there's so many resources for veterans across the state. And just educating yourself on how to connect people, should you come across someone in need, that's the stuff that saves lives.
What are some of those risk factors? I'm just curious.
Yeah, so what we learned is a lot of veterans who are just transitioning out of the military, they can struggle because they are losing the sense of camaraderie, they're losing the life they've known, so trying to, and that sense of duty and service to others. So our Military Veteran Peer Network is a great opportunity to find that camaraderie, find volunteer opportunities, get assistance if they need it, and help others. And that's something that we've seen really help a lot of folks who are struggling.
Yeah. Well, thank you again so much for being here. Again, very important topic. We're happy to sit here and hopefully spread some awareness, and hopefully people watching know that they're not alone. So again, thank you so much for your time today.
Thank you.